Hello everyone, I'm Dr. Charlotte Hayes, and today we're going to discuss something that most men don't realize they have complete control over. We're talking about your vascular health, specifically how you can dramatically improve blood flow throughout your body, including to the areas that matter most for male function in just 5 minutes, using techniques you can do anywhere, anytime. Now, I know the title might sound like hyperbole, but the science behind what I'm about to share with you is solid. When you understand how blood flow works and what restricts it, you can use specific techniques to essentially reset your vascular system, opening up circulation pathways that may have been partially closed for years without you even realizing it. The key to understanding this is recognizing that your blood vessels are not rigid pipes. They're dynamic living tissues that constantly adjust their diameter based on signals from your nervous system, hormones, and local factors in the tissue. The smooth muscle in your arterial walls can contract, making the vessels narrower and restricting blood flow, or it can relax, allowing the vessels to dilate and increasing blood flow dramatically. Most men over 40 are walking around with chronically constricted blood vessels. Not enough to cause obvious symptoms or medical problems necessarily, but enough to significantly impair function, particularly in areas with smaller blood vessels like the genitals. The good news is that you can reverse this constriction quickly using the right techniques. Let me explain what's happening at a physiological level. The endothelium, which is the inner lining of your blood vessels, produces a molecule called nitric oxide. Nitric oxide is the master regulator of vascular tone. When nitric oxide is released, it signals the smooth muscle in your arterial walls to relax, which causes vasodilation, the widening of blood vessels. More nitric oxide equals more blood flow. As men age, endothelial function declines. Your blood vessels produce less nitric oxide, and they become less responsive to the nitric oxide that is produced. This is one of the primary mechanisms behind age-related decline in function. But here's what's exciting. Endothelial function is highly responsive to acute interventions. You can trigger nitric oxide release and improve vascular responsiveness within minutes using specific techniques. The 5-minute protocol I'm about to teach you combines 3 different mechanisms for enhancing blood flow. We're going to trigger nitric oxide release, activate your parasympathetic nervous system, which promotes vasodilation, and create mechanical pressure changes that force your vessels to dilate. When you combine all 3 simultaneously, the effect is powerful and immediate. Let's start with the first component, which is rhythmic, breathing with specific timing and technique. This isn't just any breathing exercise. This is precisely calibrated to maximize nitric oxide production and parasympathetic activation. Here's how it works. You're going to breathe in through your nose for a count of 4 seconds. During this inhalation, you want to expand your belly first, then your chest. This diaphragmatic breathing is important because it maximizes the activation of your vagus nerve, which is the main nerve of your parasympathetic system. After the 4-second inhale, you're going to hold your breath for 7 seconds. This hold creates a temporary state of oxygen deficit that triggers compensatory vasodilation. Your body responds to the brief oxygen shortage by opening up blood vessels to maximize oxygen delivery. When you do breathe again, then you're going to exhale through your mouth for 8 seconds, making a whooshing sound as you release the air. This extended exhale further activates the parasympathetic system and helps release tension in your muscles, including the smooth muscle in your arterial walls. But here's the crucial addition that most breathing exercises miss. During the 7-second hold, you're going to hum. That's right. Create a humming sound in your throat while holding your breath. This might sound strange, but there's solid science behind it. Humming creates vibrations in your nasal passages and sinuses, and these areas are where your body produces significant amounts of nitric oxide. The vibrations from humming can increase nitric oxide production by up to 15-fold compared to silent breathing. Do this complete cycle of inhale, hold with humming, and exhale 5 times in a row. This takes about 90 seconds and forms the foundation of your vascular reset. Now we move to the second component, which is isometric muscle contraction, in specific muscle groups. Isometric contraction, where you tense a muscle without moving the joint, creates a temporary restriction of blood flow to that muscle. When you release the contraction, there's a reactive hyperemia, which is a surge of blood flow that exceeds the normal baseline. This surge doesn't just affect the muscle you are contracting, it creates a systemic increase in circulation. The muscle groups we're going to target are specifically chosen because they're large and because contracting them has favorable effects on pelvic blood flow. We're going to work the glutes, the inner thighs, and the lower abdominals in sequence. Start with your glutes. Squeeze your buttocks together as hard as you can, as if you're trying to hold a coin between them. Hold this maximal contraction for 15 seconds while continuing to breathe normally. Don't hold your breath during the contraction, as that would trigger a different physiological response. After 15 seconds, release suddenly and completely. You should feel a warm, rushing sensation as blood floods back into the area. Immediately move to your inner thighs. Press your knees together forcefully as if you're trying to squeeze something between them. Again, maximum contraction for 15 seconds, breathing normally throughout, then release completely and feel the surge of blood flow. Finally, contract your lower abdominal muscles, pulling your belly button toward your spine and tightening everything in your lower abdomen. This contraction also engages your pelvic floor muscles. Hold for 15 seconds, then release. This entire sequence of 3 isometric contractions takes about 90 seconds and creates powerful reactive hyperemia throughout your pelvis and lower body. Now we move to the third component, which is dynamic movement that creates pressure changes in your abdomen and pelvis. These movements essentially massage your internal organs and blood vessels, mechanically promoting blood flow while also stimulating the nerve networks that control vascular tone. The first movement is pelvic tilts. Stand with your feet shoulder-width apart and your knees slightly bent. Tilt your pelvis forward, arching your lower back and sticking your buttocks out. Hold this position for 2 seconds. Then tilt your pelvis backward, tucking your buttocks under and flattening your lower back. Hold for 2 seconds. Alternate back and forth smoothly, doing 10 complete cycles. This movement creates rhythmic pressure changes in your pelvis that massage the blood vessels and promote flow. The second movement is hip circles. With your hands on your hips, make large, slow circles with your pelvis. Imagine you're stirring a large pot with your hips. Do 5 circles in one direction, then 5 circles in the other direction. This movement further enhances pelvic circulation and also stretches and relaxes the muscles in your hips and lower back, which can restrict blood flow when they're tight. The final movement is a series of deep squats. Lower yourself down as if you're sitting in a chair, going as deep as is comfortable for you. You don't need to go all the way to the ground. Hold the bottom position for 3 seconds, then rise back up. Do 5 repetitions. Squatting creates significant pressure changes in your abdomen and pelvis, forces blood out of the area temporarily, and then creates a strong rush of fresh blood when you stand back up. These 3 movements take about 90 seconds, bringing our total protocol time to about 4.5 minutes. We're going to use the final 30 seconds for what I call vascular visualization. This might sound esoteric, but there's actual research showing that focused mental imagery can influence physiological processes, including blood flow. Studies using thermal imaging have shown that people can increase blood flow to specific body parts simply by visualizing warmth and circulation in those areas. For the final 30 seconds, close your eyes and visualize warm, oxygen-rich blood flowing freely through your body. Picture your blood vessels as wide-open channels with blood moving easily and efficiently to every part of your body, particularly to your pelvic region. Imagine warmth and energy spreading through your lower body. This mental component might seem minor, but it adds to the cumulative effect of the physical techniques. Now let's talk about when and how often to use this 5-minute protocol. The beauty of this technique is that it's both immediately effective and cumulatively beneficial. You'll notice increased circulation and improved responsiveness right after doing it, but the benefits also build over time with regular practice. For immediate effect, you can do this protocol 15 to 30 minutes before you anticipate needing optimal function. The vascular improvements from the protocol last for several hours, so you're creating an optimal window of enhanced blood flow. For cumulative benefits, doing this protocol daily, ideally in the morning, progressively improves your baseline vascular function over weeks and months. You're essentially training your blood vessels to be more responsive and to maintain better tone. Many men who practice this daily report that their baseline function improves noticeably within just 2 to 3 weeks. You can also do this protocol multiple times per day if desired. There's no downside to improving your circulation several times throughout the day. Some men do it morning and evening as part of their daily routine. Others do it whenever they have a few private minutes during the day. Now, let's discuss some advanced variations and enhancements to this protocol that can make it even more effective. The first enhancement is adding temperature contrast. If you have access to a shower, alternating between warm and cold water on your lower body creates powerful vascular training. The warm water causes vasodilation, the cold water causes vasoconstriction, and alternating between the two trains your blood vessels to be more responsive and dynamic. After completing your 5-minute protocol, you could spend 2 minutes alternating between 30 seconds of warm water and 30 seconds of cool water directed at your lower abdomen, thighs, and pelvic region. This contrast therapy amplifies the vascular training effect of the protocol. Another enhancement is the addition of specific acupressure points that influence blood flow. There's a point on the inner ankle, about 4 finger widths above the ankle bone, that in traditional Chinese medicine is known to promote circulation to the pelvic region. After completing your 5-minute protocol, you can press firmly on this point on both ankles for about 30 seconds each. The pressure should be firm enough to feel a deep spreading sensation, but not painful. There's also a point on the lower abdomen, about 4 finger widths below the navel, that's associated with reproductive health and pelvic circulation. Massaging this area with firm circular motions for a minute or two after your protocol can enhance the blood flow effects. Let's also talk about the role of body position and how it affects the efficacy of this protocol. While you can do these techniques standing, which is convenient for most situations, there are positions that can enhance the effects even further. Doing the breathing component while lying on your back with your hips elevated on a pillow creates a better angle for blood flow to the pelvic region. Gravity works in your favor, and the elevation reduces the work your heart has to do to pump blood to that area. For the isometric contractions, being in a reclined position can allow you to contract more forcefully because you don't have to maintain balance the way you do when standing. This means you can create stronger contractions, which leads to more powerful reactive hyperemia when you release. The movement component generally works best while standing, as you have more freedom of movement and can engage the muscles more fully. But the overall protocol can be adapted to different positions depending on your circumstances and preferences. Now let's discuss hydration and its critical role in vascular function. Blood is about 55% plasma, and plasma is primarily water. When you're dehydrated, even mildly, your blood becomes more viscous, thicker. Thick blood doesn't flow as easily through your blood vessels, particularly through the smaller vessels in your extremities and genitals. Many men are chronically mildly dehydrated without realizing it. If your urine is darker than pale yellow, you're not drinking enough water. Optimal hydration for vascular function means drinking enough water that your urine is consistently pale, yellow, or almost clear. For the 5-minute vascular protocol to work optimally, you should be well hydrated. Drinking a large glass of water about 30 minutes before doing the protocol ensures that your blood volume is optimal and that your blood has the right viscosity for maximum flow. There's also an interesting relationship between hydration and nitric oxide production. The enzymatic processes that produce nitric oxide function more efficiently when you're well hydrated. So, proper hydration enhances the effectiveness of the breathing and humming component of the protocol. Let's talk about the timing of meals and how it affects vascular function. After you eat a large meal, significant blood flow is diverted to your digestive system. This is why many people feel sluggish after eating. The blood that's in your digestive system is blood that's not available for other functions. For optimal vascular response, it's best to do this protocol on an empty stomach or at least 2 hours after eating. This ensures that maximum blood flow is available to be directed where you want it, rather than being tied up in digestion. Similarly, if you're using this protocol before intimate activity, timing your meals appropriately becomes even more important. A heavy meal within 2 hours of intimate activity can significantly impair function simply because of the competition for blood flow between your digestive system and other areas. Now let's discuss the connection between this vascular protocol and the health of your endothelium over time. Every time you trigger vasodilation through these techniques, you're not just temporarily improving blood flow, you're also exercising your endothelial cells, the cells that line your blood vessels. Like any other tissue in your body, the endothelium responds to regular stimulation by becoming stronger and more functional. Regular practice of vascular training through these techniques can improve your endothelial function at a fundamental level, which means better baseline blood flow even when you're not actively doing the protocol. Research on endothelial function has shown that it can be improved at any age through appropriate interventions. Men in their 60s and 70s who engage in regular vascular training can improve their endothelial function to levels comparable to men decades younger. This isn't just about immediate performance, it's about reversing age-related vascular decline and maintaining healthy circulation long-term. Let me also address the role of mental state and stress on vascular function. Chronic stress activates your sympathetic nervous system, which causes vasoconstriction. When you're stressed, your blood vessels are chronically constricted, which impairs function in multiple ways. The breathing component of this protocol is particularly powerful for stress reduction. The specific pattern of breathing we're using is one of the most effective techniques for activating the parasympathetic system and shutting down the stress response. Regular practice of this breathing pattern, even outside of the full 5-minute protocol, can help reduce your baseline stress levels and improve your overall vascular health. Some men find it beneficial to do the breathing portion of the protocol multiple times throughout the day as a stress management tool. Then do full protocol once or twice daily for maximum vascular benefits. This approach addresses both the acute need for enhanced circulation and the chronic issue of stress-related vasoconstriction. Finally, let's talk about tracking your results and understanding what improvements to expect. In the first week of regular practice, most men notice that they feel warmer, particularly in their extremities. This is because improved circulation delivers more warm blood to these areas. Some men notice improved energy levels because better circulation means better oxygen and nutrient delivery to all tissues. By week 2 to 3, most men notice improvements in function. Morning experiences may become more frequent or more robust. Response time may improve. Overall capacity may increase. These changes indicate that your vascular system is responding to the training and becoming more efficient. By 4 to 6 weeks of daily practice, many men report that their baseline function has improved to levels they haven't experienced in years. The improvements often continue beyond this point, though the rate of improvement may slow as you approach your optimal function for your age and health status. Thanks for watching today. If you found this valuable, please subscribe for more evidence-based content about optimizing your health. Until next time, this is Dr. Charlotte Hayes, reminding you that your vascular health is trainable, and just 5 minutes a day can make a profound